Channels of infection. Disease germs gain access to the bodies of susceptible individuals, giving rise to infectious diseases, through various channels. The most important of these are doubtless the alimentary and respiratory tracts, to which access is obtained through the mouth and nasal passages. It is sometimes difficult to ascertain whether infection has occurred as a result of the deposition of germs contained in inspired air upon the mucous membrane of the respiratory passages, or by reason of their having been taken into the stomach with food or drink. Germs suspended in the air would be to a considerable extent deposited upon the moist mucous membrane of the mouth and nasal passages, and would be carried thence to the stomach rather than to the lungs. However, in certain diseases, infection no doubt results from the deposition of germs in the bronchial tubes. This is true of pulmonary consumption, of influenza, la grippe, of the pulmonic form of bubonic plague, of wood sorter's disease, pulmonary anthrax, and of pneumonia. In diphtheria, the initial infection commonly occurs upon the surface of the tonsils. This is also, no doubt, true in the various forms of tonsillitis and possibly in scarlet fever. Indeed, there is good reason to believe that the tonsils constitute the avenue through which infection occurs, occasionally at least, in a considerable number of diseases of this class, including tuberculosis. The exact knowledge which has been gained during the past 20 years has made it evident that infection through the medium of the air is by no means as common as was formerly believed. We now know that malarial fevers and yellow fever are not contracted in this way, but that they result from inoculations made by infected mosquitoes. Some disease germs are quickly killed by desiccation and exposure to sunlight. These are not likely to be carried through the air in a living condition, and consequently the diseases produced by them are not propagated in this way. This is true of Asiatic cholera and to a considerable extent of typhoid fever, which diseases are recognized as being essentially waterborne. However, the bacillus of typhoid fever resists desiccation for some time, and when the surface of the ground becomes contaminated with the discharges of typhoid fever patients, the bacillus may be carried by the wind with dust and deposited upon the moist mucous membrane of the mouths and nasal passages of individuals who breathe this dust-laden air. This is also true of the bacillus of bubonic plague, and to a still greater degree of the bacillus of tuberculosis. The bubonic plague bacillus contained in the excreta of infected individuals and of rats, which are very susceptible to the disease, may retain its vitality for a considerable time when deposited upon the ground, and it is in this way that insanitary localities become centers of infection. The tubercle bacillus, which is contained in the matter coughed up from the lungs by persons suffering from pulmonary consumption, may retain its vitality and infecting power for a long time after the expectorated material containing it has been dried and pulverized. It is evident that such dust is likely to be carried by currents of air and deposited in the lungs of persons who are compelled to live in localities where such insanitary conditions prevail. No doubt this is the usual way in which pulmonary consumption is contracted. Again, the dust deposited in the mouth and nasal passages may be swallowed, and other forms of tubercular disease result: tubercular peritonitis, tubercular meningitis, tubercular joint disease, tuberculosis of the vertebral column. In smallpox, scarlet fever, and the eruptive fevers, generally infectious material is given off from the surface of the body of the sick person. This is associated with cast-off epithelium, pus cells, etc., and constitutes a kind of dust which abounds in the sick room and clings to the clothing and bedding of the patient and of those in attendance upon him. In influenza and whooping cough, the patient forcibly ejects small masses of mucus, which soon become desiccated and are likely to make up a portion of the dust in apartments occupied by such patients. Evidently, the great danger from infection in these diseases results from visiting the sick room or handling clothing which has been exposed to contamination by infectious material coming from the body of the sick person. In typhoid fever, Asiatic cholera, and dysentery, the infectious material coming from the sick person is contained in the discharges from the bowels and is usually quickly removed from the sick room. The great danger as regards the spread of these diseases consists in the possibility that ignorant or careless persons may throw these discharges upon the ground or dispose of them in some way which makes it possible for the germs to be washed into a well or a running stream from which water is used for drinking purposes. But this is not the only way in which disease germs may find their way from the excreta of the sick to the stomachs of healthy persons. If thrown upon the ground, flies alighting upon the foul material may subsequently visit a nearby kitchen and there walk over the food prepared for the family meal, leaving numerous typhoid bacilli in their tracks. Or they may fall into the milk or in some other unsuspected way convey the deadly microscopic germs to some article of food or drink. Again, articles of clothing soiled by the discharges of the sick may be the means of conveying infection to laundresses who in handling such articles are liable to soil their hands or in some indirect way to introduce the pathogenic bacteria into their mouths. This mode of infection is liable to occur in any disease in which the germ is present in the discharges from the bowels, and especially in Asiatic cholera. In Oriental countries, where human excreta constitutes a very common fertilizing material, green vegetables which are eaten raw are believed to serve as the medium through which the germs of dysentery and cholera are occasionally conveyed to the stomachs of persons partaking of such articles of food. There is also considerable evidence in favor of the view that typhoid fever may be contracted by eating oysters which have been grown in sewage-polluted waters. The infectious disease known as trichinosis is contracted by eating pork containing living trichinae. As these parasitic worms are promptly killed at a comparatively low temperature, cooked pork is quite harmless, so far as this disease is concerned. Infection through wounds is far less common at the present day than was the case before aseptic surgery and the antiseptic treatment of wounds became established as a standard method of surgical procedure. Formerly, epidemics of septicemia, erysipelas, and hospital gangrene were of frequent occurrence, and the cleanest and best regulated hospitals were not exempt from these visitations. But in the light of our present knowledge, such epidemics are no longer excusable, and the infection of surgical wounds is extremely rare. Accidental wounds may, however, become infected at the time they are inflicted or because of failure to apply proper surgical dressings. Jagged and penetrating wounds which do not bleed are especially liable to be infected by the lodgment of germs in the deeper portion of the wound. It is in this way that tetanus or lockjaw is commonly produced. The tetanus bacillus forms spores which may retain their vitality for years. These are found in soil which has been enriched by manuring and in the dust of streets. Bubonic plague is another disease which is commonly contracted through accidental wounds. In countries where it prevails, it has been observed that the natives who do not wear shoes and stockings are much more liable to infection than Europeans, and it seems to be well established that infection may occur through insignificant wounds, such as scratches or abrasions of exposed parts of the body. We have also satisfactory evidence that tuberculosis may be transmitted to man by the accidental inoculation of an open wound. Malignant pustule or anthrax is communicated in the same way, and it sometimes happens that the inoculation is affected by flies which have been in contact with the infectious material escaping from the body of an animal having the disease or recently dead as a result of it. It is well known that surgeons, when operating upon an infected wound, and pathologists, when performing autopsies, in certain cases, are liable to a severe and sometimes fatal attack of blood poisoning as a result of infection through a slight scratch or abrasion upon the hand or through an accidental puncture made by a surgical needle. The germ which is most frequently concerned in this blood poisoning or septicemia is well known and is the usual cause of puerperal fever, erysipelas, and a considerable proportion of the cases of peritonitis. It is, therefore, in treating or making autopsies upon cases of this nature that physicians run the greatest danger of accidental infection. The question whether infection may occur through the unbroken skin has been studied and an affirmative result obtained. The liability to infection in this way is, however, comparatively slight. When it does occur, it appears that the germs penetrate through the hair follicles. Infection may occur through mucous membranes, and it is in this way that infectious conjunctivitis and various other specific inflammations of mucous membranes are propagated. Infectious skin diseases such as scabies, itch, ringworm, barber's itch, etc., may no doubt be contracted by susceptible persons when conditions are favorable, independently of any wound or abrasion, especially in those who do not indulge in frequent bathing and thus give the germs time to penetrate the epidermis. Researches made during the past few years have demonstrated that malarial fevers and yellow fever are communicated to man through the bites of infected mosquitoes. Certain infectious diseases of lower animals are also transmitted by insects. Thus, it has been shown that ticks are responsible for the propagation of a fatal disease of cattle known as Texas fever, and an infectious disease of horses, which has recently prevailed extensively in the Philippine Islands, is communicated by a biting fly which transmits the parasite from diseased to healthy animals, Sura disease. The tsetse fly disease of Africa is transmitted in the same way and is very fatal to horses and also to the ox, the dog, the ass, and the sheep, but not to wild animals indigenous in the region where the tsetse fly is found. The parasite is present in great numbers in the blood of infected animals, and the fly simply acts as a carrier of this parasite from diseased to healthy animals.